Hi everybody, I'm Dr. Zainab Vohra and I have with me Dr. Avani Patel who has secured rank 32 in this year's INI-CET. So many congratulations Avani. कैसा लग रहा है? How are you feeling? Where are you from? Please tell us everything about yourself.
Thank you, ma'am. It feels really surreal. It hasn't sunken in yet. I've done my MBBS from Baroda Medical College, and I did appear for the May INI and NEET PG as well, and this was my second INI.
Amazing. What were your previous scores?
In May INI, I got a rank of 201, and in NEET PG, 85.
Wow, amazing. So all three like stellar performances and you've improved consistently. I think एक और दे दोगे तो rank 1 आ जाएगा.
नहीं
But
नहीं बस अभी this was the last one.
yeah, don't chase the rank. I'm pretty sure you'll get every single
Uh,
seat now, that is there. Every branch in any institute of your choice you'll get with these ranks. Great. So tell
yeah.
us, how did you study, through your MBBS internship? Because a bunch of great ranks, in three consecutive exams means very strong base and consistently you've done well. So, guide your juniors who are starting out, now. So, MBBS में क्या करना चाहिए and what to do in internship so that, your performance can be replicated.
I started my preparation from third first year. Before that, I would say building a base is really important.
Yeah.
Like in the first, second year, I used to read standard textbooks, which was very helpful.
Yeah.
And that goes a long way because once you build your concepts in pathology, pharmac, micro, it helps you immensely in, like, say, surgery, medicine, and the other subjects as well.
Hmm.
I started my preparation in third first year. I watched the videos and made my notes. I started giving GTs during the end of my final year, and yeah, so that was.
Very nice. So your base was very strong in terms of first, second prof, and ideal basically कि first, second prof में stick to textbooks, otherwise you will never learn the art of reading stuff or books, So that is what you did, right? And then you final year you started, PG preparation in the sense that you started doing videos so that you get that at least the roadmap of how things are, in these entrances. So, what did you do in your internship? How hectic was it? How could you manage studying during that?
We had, I would say, a moderate internship. It wasn't very hectic, except
Mm,
for a few subjects like surgery, OBG.
mm,
And in those postings where I would have time, I used to go through my notes. I used BTR as my rapid revision. I did not have any other revision source. So
mm,
what I would do is I would go through the BTR notes of that particular subject first, and because I've been following you since like your early Unacademy days, I
uh,
have watched your MRs and MKTs and all. So the transition wasn't really difficult for me. Like वो याद आता था कि मैम ने उस वीडियो में भी ये बताया, and she's integrating it now. Like I've seen you integrate a whole MKT of say GI polyps into a single page, and so the transition was like it used to feel really nice कि वही चीज हम revise कर रहे हैं, but now in a like a slightly different format.
mhm,
And also the TNDs were really great. Whenever I used to feel bored while revising a subject, I used to go through those, and uh, like they were very conceptual and had new questions as well, and especially for INI, which requires conceptual knowledge
yeah.
and includes a lot of tricky questions. Uh, the TNDs were really great. They helped me a lot, I would say.
Amazing. So you used BTR, everything in BTR, I guess, and because you were
Yeah.
familiar with the content, it was an easy transition. You used TNDs as well. So how did you integrate anything else that you had done previously with BTR? So would you do it subject wise? Would you have two parallel resources, or everything was into BTR by the end?
So for medicine, I tried to integrate everything with
Mm,
BTR.
mm,
I think integrated systems is a like very good way to approach the subject because medicine is very vast and
yeah.
it takes a lot of time to revise if you are only using the main notes. So what I did was just into my BTR notes, I added like any missing information or any tables which I felt
Yeah.
were important, and that was it. I so revising medicine was a lot easier after I integrated into the integrated systems part.
Yeah.
And for the other subjects, what I would do is, for the short subjects, I used to go through the BTR notes once.
Mm.
It didn't take much time, and then I would switch to the main notes and revise those. And similarly for the long subjects, what I did was, I tried to make notes uh, of topics which I felt were left out from BTR,
Mm.
and then I used these two resources. And I had a 20th notebook as well, where I would write down, like as you say, mention only those mistakes which are repeated, which are asked many a times. Like uh, I made many silly mistakes. Like I was always confused between asbestosis, silicosis. That was on the first page of my 20th notebook,
Yeah.
and I made that question wrong so many times. So I knew
Mhm.
what to put into my 20th notebook.
Yeah.
So
I
that
mean,
was also very helpful.
very nice, you know. So you basically used BTR and you used main notes, which you had already, revised.
Yes.
And you got depth to topics, you know, where you felt were important. And you used BTR as a roadmap and selectively went into the depths of, different topics.
Yeah.
Amazing. What are your takeaways from the three exams that you have aced? That ultimately, what is it that is the most important thing that one has to keep in mind when they are preparing? Because when we are preparing, our mind goes into, okay, ye bhi kar lete, ye bhi kar lete. But when you give the exam, the mode completely changes. So now, when you look back, what is it that you find is the most important thing, which is non-negotiable for any student who is preparing?
I would say practice of MCQs and going through PYQs multiple times is a lot important,
Yeah.
because what I experienced was during my May INI, I did not manage my time well. Like when you sit at your home, when you are in a comfort zone, you can finish a GT like in 2.5 hours. But when
Yeah.
you give the real exam, you have sets where you don't
Yeah.
just you are left with 2 3 minutes. You don't have time to go through questions again.
Yeah.
Like you get fixated on one question, you waste time on a few questions, and that can spoil the rest of your exam.
Yeah.
So to get better at time management, I would say practicing GTs and going through the explanations, not getting disheartened by whatever score you are getting, and just taking it as a practice, and going through the explanations well. And for INI, I would say especially going in depth of the PYTs is important, because even in this INI there were questions which were there were topics which were repeated, but the questions were totally new.
Yeah.
So go in as much depth as possible. There are like first, second year subjects, biostats, OBG, surgery. These are the subjects which INI is very heavy on.
Yeah, amazing. So very, very well done, Avni. Like completely, you have basically done your MBBS very well. You did your internship well, used a revision source the way it should be used. So you've actually ticked off every box, and you've aced three exams. So very, very well done. And which branch are you planning for?
I am still confused. I'm thinking of radio, but a bit skeptic about
Yeah.
it.
Yeah, you have all the options, to explore. So I'm pretty sure you'll get it into a central institute. So, that's the best place if you're planning to do radiology, like do it from a central institute for sure. That's what I can tell you. So yeah, very well done. We can talk more soon about this. So thank you so much for talking to me and all the very best.
Yeah. Thank you, ma'am. Thank you.